Everyone, and welcome back to another edition of Your Adrenal Fix, where we teach exhausted and burnt out adults the truth about their health so that they can get their health back quickly. And it's a pleasure for me to be joined by Michael Platt, MD, who's board certified internal medicine. He specializes in wellness and hormone therapy. He's considered one of the leading experts in managing excess adrenaline and the use of high dose progesterone. He's the author of 3 books: The Miracle of Bioidentical Hormones, The Platt Protocol for Hormone Balancing, and the one that we want to be talking about today is the adrenaline dominance. So Dr. Platt, thank you so much for being here today.
I'm glad to be here.
Excellent. Thank you. So I always start with hearing maybe your own health journey and why you maybe the Reader's Digest version of why you got into healthcare in the first place, and tell us about any health challenges or why you got into this area in the first place.
Well, in terms of becoming a doctor, it's just something I always wanted to be. But what actually guided my way into hormones was the fact that my mother died of breast cancer at the age of 61. She's pretty young. And I realized right after she died that I had inherited her hormones. You know, most people don't realize that men and women have the identical hormones, different levels, but the same hormones. And the fact that she had breast cancer, told me that she was low in progesterone, too much estrogen. And the thing is, at that time when I was driving, I used to have to slap my face trying to keep my eyes open. And I thought, well, maybe there's some kind of relationship here. And I figured I was putting out too much insulin. And I thought, well, because she's low in, I said, I'm probably low in progesterone, just like my mother is. So I started using progesterone. And from the first day that I've done that, I've never gotten sleepy in a car anymore. And that got me really interested in hormones. And so I, learned as much as I could. And I had a great advantage over a lot of other doctors because I had, I was able to spend at least 2 hours with every patient. And let me tell you something, when you sit down and talk to a person and find out what their problems are and then see how they react to certain things, you learn a lot. And, one thing you might notice in my books, there are no references because everything I've learned from my patient. They call that observational-based medicine. Doctors are more comfortable with what they call, what's the other type?
Like peer-reviewed, research-based articles.
Yeah,
stuff like that.
Yeah. But anyway, so that's how I got involved with hormones and.
Right. Gotcha. So, and you are outspoken about that. Maybe we'll just go into it a little bit in terms of just being dissatisfied with the medical system, finding out that your mother, passed away with potentially a condition that had she been properly worked up, she could have stayed around for longer. Having the benefit of having 2 hours with each patient and asking questions and pulling in relevant information that you can't glean in a 2-minute encounter. And you've mentioned how the idea is unknown in the medical community and misdiagnosing. So maybe we can start from there in terms of why is that happening, do you feel?
Well, something that a lot of people are not aware of, that doctors, first of all, they get no training in hormones. Even though hormones control everything in the body, doctors get no training in hormones. And what's interesting, especially gynecologists, and that's who women go to get hormone advice. And the other thing is that doctors are not trained to treat the cause of illness. They're just trained to give out Band-Aids. And a lot of this, of course, is because drug companies have a tremendous control over how medicine is practiced. And, they control the FDA, they control the medical boards, they control medical schools. And what's interesting about drug companies, they have no interest in people being healthy. And that's who runs our whole medical system. And that's why, as we speak, the United States is on the bottom of the list of all civilized countries in terms of healthcare. We have a terrible healthcare system, and people not aware of it.
Yeah, it is discouraging, and I do think it's sort of like a ship turning in the ocean. It takes a long time to really see progress, but I guess just glancing out into the future, do you see that ever changing? Do you see that there's enough doctors, I guess, as the older the older trained doctors phase out and the newer ones change in, that we'll have some form of medicine 3.0 at some point, or do you see that happening?
I don't see it. To be honest, I do not see it changing. Do not see it changing.
Okay, well, with that, let's go into the great information that you've discovered with just your own observations and with your patient base. You wrote this book called Adrenal Dominance. So what exactly is adrenal dominance?
Well, I think most people have heard of adrenaline. It's both a hormone as well as a neurotransmitter. And what people are not aware of is the fact that this is a very powerful hormone, and that has a tremendous influence on our health. And because most people think of adrenaline as what they call the fight or flight hormone, and that's true. When people are in danger, the body pours out adrenaline, but that's a very rare reason why the body releases adrenaline. What most people do not know is that the brain uses more sugar than any other tissue in the body. And anytime the body detects that the brain is running out of glucose, sugar, it puts out adrenaline to raise glucose levels. So the main function of adrenaline is to raise sugar levels. And this is something that goes on all day and all night. The body trying to keep sugar levels, and as a result, people can start having a lot of symptoms related to excess adrenaline. And when people have a number of these symptoms, this is what I refer to as adrenaline dominance. People have heard of estrogen dominance from Dr. John Lee, and this is another type of dominance, just adrenaline dominance. And we can talk about all the symptoms related to excess adrenaline if you want.
Yeah, let's do that. Let's just go parlay right into, if someone is dealing with excess adrenaline dominance, then what would they present as?
Well, there are many people that have what's called insomnia, get trouble, staying asleep. Some people have trouble falling asleep. Some people toss and turn, they grind their teeth at night, they get up at night to urinate. These are all actually symptoms of excess adrenaline. And again, when people have a lot of adrenaline, they'll probably notice they carry a lot of tension in the back of their neck. And this tension can cause ringing in the ears, tinnitus, and it can cause severe headaches called occipital neuritis, which are always mistaken for migraines. But every patient that I've ever seen who's been diagnosed with a migraine actually has occipital neuritis. And now the difference between that and the migraine is that the occipital neuritis is easy to fix, and we'll talk about this. Again, when people have a lot of adrenaline is the cause of anxiety. There's a lot of talk about anxiety nowadays. The other thing is it's an anger hormone. And you may have heard of road rage, and road rage is caused by excess adrenaline. When people have a lot of adrenaline, they might notice they have cold hands and cold feet because adrenaline constricts blood vessels. It's a survival hormone, so it cuts off blood supply to areas of the body not needed for survival. And so this is where something called irritable bowel syndrome comes from. IBS, because it cuts off blood supply to the intestines because they're not needed for survival, when people are in danger. So So, and there are a lot of conditions that we'll talk about that are related to excess adrenaline. And that's where the good, the bad, and the ugly comes in. The way in my book, and each chapter I talk about the good, and the bad, and the ugly. And what's interesting, the only condition that I put into the good category was ADHD. And that might surprise a lot of people because ADHD is terribly underdiagnosed. Anybody who's intelligent actually usually has ADHD because adrenaline is the hormone that gives people intelligence. And later on we can talk about some of these conditions.
Okay, no, excellent. So as far as I would like to get into the good and the bad and the ugly, I guess just one of the questions I would have is because of Wi-Fi and internet and text messaging and notifications and emails, and even just the way that glutamate is in our foods and artificial flavors and sweeteners and stuff like that. Do you see, Dr. Platt, that the adrenaline dominance is getting worse over time, not better, or is it staying at that about the same?
That's a very interesting question. I think it's about the same because all the conditions we're going to talk about are still as prevalent now as they were when I was in medical school.
Right. Well, I would just say, and I don't want to go too far down this rabbit hole because I know glutamate is another major excitatory neurotransmitter. And with glyphosates in our soils and all of the MSG and the artificial foods that have very high amounts of glutamate, if you ask educators or you ask social workers or any one of them, hey, tell us about your new entry student that are coming in. Are you seeing a difference even within the last 5 years or 10 years? And 100%. I mean, you look at these school shootings and you look at all of these crazy anger rages. Would you at some level connect that to other factors, or that's just sort of a prototypical adrenaline dominance presentation?
Well, there's always other factors involved, but
Right.
I think adrenaline is a key factor.
Right. Right. Okay, so let's get into the why ADHD. There's different classifications of it in your book, and how they manifest and the relationship between that and too much adrenaline.
First of all, let me explain to people about what ADHD stands for attention deficit hyperactivity disorder. And the thing, it's not a learning disorder. ADHD is an interest disorder. If people with ADHD are interested, they will focus. If they're not interested, they will not focus. And what causes ADHD is excess adrenaline, and adrenaline makes the mind go very quickly. So that's why it's hard for them to focus on things they're not interested in. But what's interesting is that we will be talking about treating excess adrenaline, but you can actually eliminate ADHD in as little as 24 hours just by lowering adrenaline. Right now they put children on drugs like Ritalin and Strattera and Adderall, and what a lot of people don't realize that one of the side effects of these drugs is sudden death, and they're giving these drugs to children. And yet here we are, we're in a position we can actually eliminate ADHD without drugs, and it's unknown to the medical community.
Right. And so maybe we can go into that. So you were noticing that when you were driving, you couldn't stay awake, and your mother and her premature death from estrogen dominance. And I guess connect the dots for me and the listeners, how progesterone was that puzzle piece that not only helped with the conditions, but helped to ameliorate the excess adrenaline.
Well, progesterone has primarily been known as an anti-estrogen hormone. In fact, that's all it's been known for. what but what's unknown about it, progesterone, is that not only does it block estrogen, but it also blocks insulin and it blocks adrenaline. And it's really a remarkable miracle type hormone that is unknown, again, to the medical community for the most part.
So when you say block, you mean it competes with the site, or how does it block it? What do you mean by that?
Okay, now keep in mind that I'm not a scientist or a researcher.
Right. Okay.
And I observe.
Right.
And
so the theory, yeah.
Yeah, so I just assume what it does is that it just blocks the same receptor sites, that if it blocks the estrogen and the adrenaline receptor site.
Right. Well, what I like about your, with your observation, and you noted in your book, I mean, that's how we observed penicillin, right? And was able to justify that. And if we didn't have the ability to put together our thinking caps and see cause and effect, we wouldn't be able to have these validations of things that are effective. So as far as with the progesterone, I guess take me through how you, like, I like the concept of pulsing and knowing, okay, if I take this and it helps, then it's this. If it doesn't, it's that. So take us through sort of the mindset of clinically seeing these causes and effects.
Well, what's nice about progesterone, when people have a lot of adrenaline and they excess anger and they can't sleep, and when you see people sitting down and their knee is going up and down, that's all adrenaline. Okay, so what's nice about progesterone is that right after you apply it, basically within just a few minutes, people feel more relaxed and they can focus better. Which means it helps with their ADHD. So anyway, so it's not the kind of thing where you take a drug and just wait 3 weeks to see if something happens. Here you get immediate feedback.
Right. And you have your own formulation. I'm curious to know about the dosing strategies. What have you found the appropriate starting off, and based on your clinical background and just seeing the impact that it's having, what's typically the approach?
Well, first of all, people need to realize that it's a very safe hormone to take. But when it comes to adrenaline, and this again is through observation and whatever, what I have found is that the ideal strength of progesterone should be a 5% cream. And 5% means that each pump is 50 milligrams. And that's the exact strength you need to block adrenaline. Most over-the-counter progesterones are 2%. So they really don't even touch adrenaline. But what's nice about progesterone, just to give you an idea of how safe it is that I use progesterone to treat babies that have colic. Now, colic is caused by adrenaline. And these are the babies that when they're in the womb are the ones that do all the kicking. And that kicking is just another sign of excess adrenaline. So when the baby is in the womb, it gets exposed to incredibly high levels of progesterone. I mean, ones that can't be duplicated. So I have come to the conclusion that if a fetus can tolerate huge doses of progesterone, it's got to be safe for a child. So,
right. So you're doing suggesting potentially 5%, which is 50 milligrams. And again, this is just for information purposes. Only talk to your provider or your doctor about what's appropriate for you. But as far as the 50 milligrams, would that be something that you could potentially, if you're seeing a certain half-life where the patient or the person who's using it starts to feel that adrenaline coming back, you could do like every 6 hours or something like that?
Oh, even sooner than every 6 hours. You really can't harm yourself with progesterone. So I usually tell people if they have a lot of adrenaline, they're probably going to need it in the beginning 4 times a day. And then as the adrenaline levels come down, then they can reduce the dosage.
Right.
But
Right.
usually to twice a day. But but and we're going to go into this later. You know, the progesterone cream is one of the treatments. It's not the main treatment. You know, the main treatment is to treat the reason why the body's putting out adrenaline. And again, remember we talked about sugar levels, so we'll talk about that. But while we're talking about progesterone, one thing I really have to let your listeners know that probably 90% of the progesterones that are sold today are in the form of capsules, like Prometrium. And the whole thing about oral progesterone is that it gets in the GI tract, goes straight to the liver. Once it goes to the liver converts it into a different hormone called allopregnanolone. So oral progesterone is not progesterone, and yet that's the progesterone that doctors are prescribing, of course. So
Whereas when you do it from a cream, let's maybe tell the listener what the effectiveness of that is.
Well, the cream gets absorbed transdermally, so it goes directly into the bloodstream. And again, when you take it orally, it goes straight to the liver and converts into a different hormone. So that that's the difference between them.
Right. Just curious, because I do different kinds of sort of outside the box testing. Do you ever, I mean, it's all when you present with adrenaline-like symptoms and the laundry list of all the different ways that it shows up in your body, it's not really a question of whether it's a problem or not. But with that being said, is there ever, or have you ever done urinary testing to see what the levels are for pre and post, or do you ever do testing to see what the progesterone levels are, or what's your suggestion with having that as the companion guide to the concept?
You know, to be honest with you, I don't ever remember ordering a progesterone level. I've always have felt more comfortable treating patients rather than lab tests. And the reason for that, you could never go wrong treating a patient, but you go awfully wrong treating a lab test because lab tests vary. And while we're talking about lab tests, you know, people have to be very careful about saliva tests. And I know all the arguments pro and con, but I also know about adrenaline. And adrenaline, remember I mentioned it's a survival hormone, and it cuts off blood supply to certain areas of the body. And one of these areas are the salivary glands because they're not needed for survival. So again, I don't trust any of the levels from a saliva test if people, because you know, most of the people I've seen have a lot of adrenaline. Not everybody does, but a lot of people I've seen.
Right, and it's a good segue, and I thank you for sharing your observations. As far as you write in your book about the difficulty or to be aware of the difference between adrenal fatigue per se and adrenaline dominance, and you do mention that with the saliva tests, where a lot of the times those saliva tests will be low, just to paraphrase what you were saying, because of the fact that adrenaline is so high, and as adrenaline is so high and it creates constriction of the vessels that create blood flow, that cuts off the ability to create I guess a cortisol in the saliva. The other thing that I would find to be also going on at the same time, because as you mentioned, there's a host of other things. There's a cell danger phenomena where if you are in fight or flight survival mode and your body only has a limited amount of resources to get over the immediate survival for survival purposes, it prioritizes what it does and what it doesn't do. So what I've seen is that it has more binding protein so that it doesn't allow that free fraction to be available in the saliva. So that's one of the ways that could also explain why the saliva levels would be lower. But I agree with you is that you have to be careful with a test to make an interpretation, because if that saliva percentage only represents, say, 1 to 5% of the total, and the amount is the other 95%, I've always said it's like looking at an ocean like this and saying there's no boats in the ocean, and then taking off the blinders and seeing the 95% of the other part of the ocean. So I do appreciate that. I guess what would you say then is if you were to say, is it an adrenal fatigue problem, or is it an adrenaline dominance problem? How do you answer that?
Well, usually what I tell people that adrenal fatigue is a condition that does not exist. It's basically a naturopath diagnosis, because they're the ones that do the saliva test. And but so the thing, as you mentioned, the hormones don't get into the saliva because the adrenaline is cutting off the blood supply to the salivary glands. And but they would find, so when they get the cortisol level in the saliva, it's going to be on the low side. And based on that, they diagnose adrenal fatigue. But if they did a blood test for that cortisol level, they would find that the cortisol level is high. Now, again, they had to be careful. There's so much misinformation in the medical system. You have no idea. But the thing is that the way they determine normal levels of cortisol in the blood is they tested medical students in hospitals, because they're readily available, to do studies on. And the thing about, doctors, medical students, they all have increased adrenaline. I can't say 100%, but it's probably pretty close to that. And so for the normal level of cortisol, they have it down as either 19.4 or 23.4, depending on the laboratory. But you have to remember that they were testing people that had high adrenaline levels. So what I'm saying is that when they do a cortisol level on the blood, and it has to be before 9 o'clock in the morning, the any level above 13.5, I consider high, even though the normal level goes up to 19.4. So, but again, that's the advantage I had of being able to spend a lot of times with patients.
Right. Yeah, no, just to recap, and I agree with that to an extent, and I'll just share some of my experiences, that if you're basing your standard of what's normal in a blood range on people that are exaggerated than the normal population, and you're comparing your levels to them, and you're told that it's low, then you have to question whether or not that's true, or if there is such a thing as an adrenal fatigue problem. I've gone down the rabbit holes of the adrenal fatigue because of my own challenges. And the more I go down the holes, I realize it's a supply and demand problem. You have more demand than supply, and hence you could produce more adrenaline and fight or flight hormones. But what I also find is that 95% of the HPA axis dysfunction occurs outside of the adrenals. So how the pituitary signals to make the ACTH, or how the cortisol is converted to an inactive form through an 11 beta HSD enzyme, or how the binding proteins bind more proteins. There's also heat shock protein. There's a lot of mechanics that go on. And I would say it's not really accurate to say it's high or it's low. It's dysregulated nonetheless. But that being said, as far as the next step, I guess you mentioned about blood sugar and the reasons why the brain would, or the signalers would detect that the brain needs more support for energy production, and create an increase in adrenaline production and create this dominance. So in your book, you talk about types of dietary approaches, which, if doctors don't learn about hormones, tell me what they learn about nutrition. Yeah.
Well, well, while we're while we're talking about this, I should explain where cortisol comes in with regard to adrenaline, and why it's a good test to do. The adrenaline actually peaks at 2:30 in the morning, and actually a lot of people get at that time to urinate, because the adrenaline gives people that urge to urinate. In fact, they have a condition called overactive bladder in women, that these women that have to rush to the toilet, otherwise they get leakage. But again, that overactive bladder is caused by adrenaline. And just like bedwetting in children is caused by adrenaline. And but the thing is that adrenaline peaks at 2:30 in the morning. Now remember, people are usually lying in bed at that time, and adrenaline is a very powerful hormone, so it creates stress to the body, and the body responds to stress by putting out cortisol. So now what's interesting, now remember the body is putting out adrenaline to raise sugar levels. And the other thing about cortisol, it also raises sugar levels. And the whole thing about sugar, it doesn't matter whether you're eating sugar or if the body's making sugar. If you don't burn it up, the body takes all that sugar that's not being used and puts it into fat cells for storage as fat. And I think that excess adrenaline is probably the #1 cause of weight gain, and nobody ever talks about it. But that's neither here nor there. So so that's why cortisol is a good test to do in the morning, before 9 o'clock.
With blood, and knowing that if it's above, say you've seen above 11 was the number that you typically see, or
actually 13.5. Yeah.
So is it safe to say then that really it's adrenal glands that produce both the catecholamines of adrenaline and cortisol, that because the baseline being compared to medical students that are stressed and overworked in those terms, they're being told that it's low, and really the reality is that it's more of an adrenal dominance, not just adrenaline, but adrenal, cortisol, and adrenaline. Was that a fair statement from your?
That's fair. Yes.
Yeah.
It is.
Okay, so as far as your book, and you do get into brain supplementation as well, which I think is interesting. I want to get into that. But as far as it's not just, and the progesterone, to recap, potentially 5%, which is 50 milligrams, starting out at somewhere between about 4 doses a day until you notice the calming. I guess before we get into the dietary approach, tell me how satisfying it must have been to see how effective this has been with the people that you've used it. Is it just sort of random, like maybe 10% of the people that fit the bill get results? Or, I mean, obviously you can't put a definitive number, but what have you seen with this?
Well, let me perhaps describe a patient that might explain how I feel. This was, and he's in my book. He was 47 years old. The reason he came in to see me is because every morning he would wake up and vomit. Now, the only thing that causes that kind of problem is adrenaline. So, and the other thing is, he had a lot of adrenaline, and he had severe fibromyalgia, which again is another condition caused by adrenaline. So I took some progesterone cream and I put it on his arm, and he rubbed his 2 arms together, and we started talking again. And after a few minutes, he sat back in his chair and he looked at me and he said, "Doc, in my entire life, I have never felt this good." And let me tell you something, it's very rewarding to help a patient. And doctors don't see that very often. And this is what they're missing. Again, it all comes down to treating the cause of illness. And for some reason, the drug companies do not want doctors to know how to treat the cause of illness.
Well, it's not so much for some reason, as you've mentioned in your book, you can't put a patent on a bioidentical. Would that be accurate in terms of why it wouldn't necessarily be part of the lexicon, so to speak?
Well, more definitively, you can't patent a natural product.
A natural product, right? Correct.
Yeah. So, and these bioidentical hormones are natural products.
Right. So have you seen, I
So,
guess, just as a side note, with the Prevera and the Premarin, those be problematic at all? That's a big one.
uh,
That's a big rabbit hole to go down, right?
well, my mother was on Premarin, which is a horse estrogen. The body doesn't even recognize it, and yet it, at one time was the most most largest selling drug in the world. And what women never were told, it came from pregnant mare's urine. That Premarin, pregnant mare's urine, is that when these uh, mares gave birth to their colts or foals, they killed the foals because they had no need for them. So I think if women knew how these were manufactured, they probably would not have. But in any event, these are synthetic hormones, which shouldn't. And the only hormones that go to receptor sites are the natural ones, the ones that the receptor sites recognize. So you can see why there's so many side effects associated with the Proveras and the Premarin.
Right.
Um,
Right. I actually didn't know that. And it makes sense. Pregnant mare is Premarin. Yeah, I didn't know that was how it was coined. So as far as what is the suggested adrenaline dominance diet that you've put in your book?
well, here's the thing. You remember we talked about treating the cause of illness, and the reason why the body is releasing adrenaline is to raise sugar levels to the brain. Okay, so if you know that, um, and if you provide the fuel that the brain requires, the body doesn't have to use adrenaline to do it. And so the thing about the brain, it uses two different fuels. Now, one is glucose, and the best source of glucose for the brain comes from vegetables. Not You don't think of vegetables being high in glucose, but they're sugar, but they are carbohydrates and they break down into sugar. But what's nice about these type of sugars, they don't produce a lot of insulin. Candy and soda are great sources of glucose, but they produce a lot of insulin, which lowers sugar levels and defeats the purpose. Okay, so glucose is one of the fuels. Now the other fuel is even more important, and those are ketones. And if people have heard of a ketogenic diet, which I have never recommended because it's a hard diet to accomplish. People want to do it, they can, but um, but you can get ketones directly from coconut oil or something called MCT oil, which comes from coconut oil. So if people add coconut oil or MCT oil and vegetables into their meal plan, there's a significant drop in the adrenaline levels. And this is the main key to controlling adrenaline is eating correctly. The progesterone is very helpful, but not as helpful as eating correctly. So these are things that people can do at home. They don't need to go to a doctor to get coconut oil or MCT oil. And progesterone is an over-the-counter product. We have it on my website, the 5% progesterone cream, but I'm just saying it's available,
Right.
without a prescription.
Right. So okay, to summarize, and you're wanting to get or maybe you can tell us a little more specifically a low glycemic, healthy fiber-based carbohydrate that's going to deliver a steady fuel supply, but also at the same time removing the high fructose corn syrups and all of the sugary foods that spike the glucose, and then getting MCT oils and potentially coconut oils. As far as what's your theory, and I'm sorry I didn't read specifically on, I know, and I'm against this, where when people say they have this adrenal fatigue thing, when it's dysregulated challenges with too much stress in their body and a demand and supply problem, that they should eat multiple meals more slowly, or sorry, multiple meals frequently throughout the day, which I disagree with 100%. But what's your thought process on what that diet should look like in terms of just everything else beyond what we've already mentioned? What else could they do to stabilize their adrenaline?
There's no one size fits all. And the reason for that, everybody's different. And, for example, in the book, I talk about creative people. And creative people actually have the most adrenaline. And the reason for that is that the creative brain is always acting, so it's always working, and uses up a lot of energy. So these are the people that have the most adrenaline because they're using the brain the most. That's why there are certain conditions that you only see in creative type people. For example, bedwetting in children, you only see that in creative type children. Women that vomit throughout their entire pregnancy, it's called hyperemesis gravidarum. You only see that in creative type women. These and all these conditions are caused by excess adrenaline, which doctors don't know, by the way. So I mean, how can you get somebody well if you don't know what's causing their problem? It boggles my mind that, my book, Adrenaline Dominance, is the only book ever written that talks about adrenaline. Why is that? I mean, anyway, but so, but if doctors were aware of an alternative approach to getting people well, and they could get their patients feeling well, I think, you probably have a lot more doctors getting, wanting to go into medicine. Right now, I think doctors are leaving medicine. I'm just saying, it's not hard to get people well if you treat the reason why they're not well. It's as simple as all that.
Well, I mean, I think a big part of it, amongst everything you've said, is that just that interaction, that take your, I look about the old, bring your doctor's bag and do the house call and be the generalist and listen to the patient and hear what their challenges are. It's not hard to figure out what the Pareto's principle of what you could implement, the smallest implementation for the biggest return. And it doesn't have to be a pharmaceutically based approach. And in this case, it's sensible. Let's figure this out. Let's get to the root of the problem. And I think even more so, the root of the problem is not just so much diet, which is a huge part, but it's just all of the stimulants that we have. We're in fight or flight 24/7, the way that the world is going. That's when I asked you the question, do you think it's the same? In my opinion, I think it's sort of like, what is it? The sky's falling in terms of the worst of the worst, as more challenges and stressors and so forth create even more demands for adrenaline release besides just sugar.
Are you familiar with the term long COVID?
Yes, of course. Yep.
And that seems to be a big issue nowadays. But a lot of the symptoms of long COVID are actually related to excess adrenaline. Now, the thing is, when you talk about fight or flight, what I have found is that some people with Lyme disease, where it's not fully treated, the body is in a fight or flight situation, and they have a lot of symptoms of excess adrenaline, in addition to the Lyme disease. People that are exposed to mold in their house, I have found very often have a lot of excess adrenaline because I think the body, again, is in a fight or flight. And I think the same thing is happening with long COVID, that the virus is still around and the body is in a fight or flight mode. But again, that's, I'm sorry about that.
That's okay. Yeah, and I agree with that. I mean, I do feel that, again, what I've looked at is try to simplify it as much as you possibly can and realize that with our fast-paced life and the depleted minerals in our soils and the food quality and the demands that we have, that we just, if we were a bank account, we'd be in the red. And when we're in the red like that, we gotta figure out how to cash in our mutual funds or liquidate our assets and sell our stuff on eBay. And hence we're in that adrenaline dominant state. Would you agree with that?
I would agree with that. Yeah.
Gotcha. So as far as the brain supplements that you recommend, which I peeked at, and I was intrigued with some of the ones that you had down there. Tell us how you derive those or came up with those.
Um, we we're going. I wrote the book quite a while ago, so
Okay, well, that's okay. I mean, you have some adaptogens in there. I really like that you had alpha GPC you had in there. So I guess were those just ones that you researched on your own that have L-theanine that modulate the adrenaline response and stuff like that?
Again, adrenaline also acts as a neurotransmitter. And so these are supplements that are actually good for neurotransmitters.
Right. And I didn't go on your website. Do you have your own nutrients that you recommend as well, or is it mainly just the dietary approaches and the progesterone?
No, well, we have all the the usual supplements, along with the hormone cream. So
Gotcha. What's your next book?
I don't know. But I think about it all the time. I have a lot of anger toward the medical system, and so I don't know if I should be writing a book. But people don't. To me, the medical system represents what's going on with our whole political situation right now.
Make sure you release that, because they're gonna have too much adrenaline dominance if you don't. And you so
yeah.
So I always do like to ask my guests what you wish you would have. I'm interested to hear your answer now, given what we've talked about. What you wish you may have done differently, or what you would have told your younger self looking into the future, knowing what you know now, from the perspective of it would have gotten you closer to your goal before you knew it, or it would have avoided some obstacles or hurdles, or would have advanced your health and your wellness. What do you think those pieces of information would have been?
I had a run-in with the medical board in California, and it's not because patients complained or I harmed somebody. It's because doctors were upset that when their patient came to see me, I took them off all their medication, and that's true. I did. But again, remember, I approached their problems from the cause. Okay, so they reported me to the medical board, and the medical board is funded by drug company. So when they heard there's a doctor who's taking people off drugs, they went after me, probably more aggressively than any other doctor ever in California. And I finally was forced to surrender my license, even though I've never harmed anybody. But you can't fight the medical board. But if I had to do over again, I would have learned not to antagonize all these doctors or the medical board. I'm just saying.
Would you have taken another profession, like another specialty that doesn't have sort of the front lines or more acute? Because what I've said is I'm from a traditional based family, and I'm an alternative based practitioner. And medicine 1.0, 2.0 is great at acute based care. And, a heart attack, a ruptured spleen, a broken bone. But when you have a chronic based problem or a stress based problem or a perfect storm environmental genetic based problem, the model doesn't fit very well unless you're in the acute based specialties. So do you think you would have changed the specialty, or would you have done it differently in terms of just not rocking the boat, but being more of a puppet? Or would you have gotten into a different specialty altogether, or a different profession altogether? Just kind of curious.
I don't see myself ever doing that. Medicine has always been a passion for me, and it's very rewarding getting people well, and I would never want to give that up. I just would have changed my attitude toward the medical board's experts read my books, and they all said the same thing, that the ideas in these books were so dangerous that I should never have been practicing medicine. And yet all the book talks about is using hormones to get people well, treating the cause of illness. But I could see where the medical board is protecting the drug companies and why they would say that. But that's who they are.
So what do you mean then? You wouldn't have been you wouldn't have written the books, or what would you have done?
No, I would have, no, nothing would have changed except, for example, I had to take some special exam down in San Diego. And when I was talking to these doctors there, and they asked me how would I approach a certain problem, for example, asthma. I said, well, when we put somebody on progesterone, their asthma disappears. In other words, this is something that is so far removed from the concepts of what they're used to. So they failed me. So I would have learned to be more accessible and agreeable. But someday, I think they're going to look into the medical boards and see how they treat what are called alternative medicine doctors. They allow doctors to prescribe opiates and kill people to go on for years before they go after them. And that they don't have a problem with. But using an alternative way of, a natural way of healing somebody, they will not allow. But anyway, that's neither here nor there. Okay.
Right. But so, okay. So you've written these books, and I guess we don't know what's next necessarily in terms of what book you would write, but I guess maybe what is it that I'm curious that what gives you pleasure? What makes you happy?
Answer well. I'd have to think that I would have to think about for a while.
Well, you already mentioned helping patients, right? So are you still, even though you're not on the front lines in that way and getting that satisfaction, like when you put the progesterone on that gentleman's arm and it was the best thing that he's ever had, do you still get to experience feedback from your readers or from people that are getting your help from your product line and so forth?
People do get in touch with me, the phone numbers on the website. And I do, talk to people about some of their problems. I spoke to a woman this morning who has a two-year-old son, who for 4 months had colic, 4 months, almost nonstop colic. And unfortunately, if I had spoken to her, you can get rid of colic in 5 minutes in a child, 5 minutes, just by rubbing progesterone cream on the belly. So I still am reaching out and trying to help people where I can. I'm not allowed to practice medicine. I've been arrested 4 times so far. Okay. It's but medicine, I would not change the way I practice medicine.
Right. So it sounds like a love-hate in that you got to help a lot of people and discover and go down these different rabbit holes to figure out how you can truly listen and help people. But at the same time, we're sort of vilified for doing it the way that it wasn't recommended. And I'm sorry that that's what you've had to experience. I do thank you for your time on today's podcast. Any other words of wisdom or any other commentary things that you want to discuss before we sign off here?
Well, I don't know when this is going to be shown, but we're coming up to July 4th weekend, and a lot of firecrackers, and this can scare dogs. And what people don't realize, that progesterone is wonderful for dogs, and it gets rid of, you may have heard of anxiety, people leave separation anxiety in dogs. You can get rid of separation anxiety in about 1 minute with progesterone cream put into the ear of the dog.
Mm.
And also it'll take away their fear of thunderstorms and firecrackers. So
Just
I could mention a lot of other things about what progesterone could do, but people, if they're interested, I think will get a lot of information out of my book.
right. And the book is called Adrenaline Dominance, and as well as The Miracle of Bioidentical Hormones and the Platt Protocol for Hormone Balance. Your name is Michael Platt, MD, and we will leave links to your websites or your website so that they can check out more information from you. And I appreciate your time today, and thank you for being so candid with your information.
You're more than welcome.
Thank you.